Well, that is a popular phrase, and I think sometimes it's used to cover up lack of action. Living with COVID also means that our schools are well ventilated, and that we continue to ensure that we have access to things like antiviral drugs for people who are more vulnerable, the elderly, etc. And in future, it is likely, because the pharmaceutical companies are already working on this, are tailored vaccines that are more effective than the ones right now that could work against a range of coronavirus variants. Now, that is something that going forward would really help to blunt the impact of winter surges. So hopefully this is going to be the last winter in which more extreme measures would need to be brought in, but it's certainly not going to be the only time that we're going to see cases surge again, even with layers of booster protection, et cetera. However, going forward, we're going to have more availability of antiviral drugs, plus potentially a type of vaccine that's multivalent and is able to recognize, protect against different strains and variants. And that's really something that would be available on a more of an annual basis.
So I think what we've seen is that case numbers have declined. It's people's behaviour that are going to make the difference over the next 4 weeks on whether those case numbers continue to decline, stay the same or rise. Clearly, when you're working from home, you have less social contact, but we're already seeing some people start to go back into the office and mix and socialise more. They need to do that carefully and within the guidelines, taking care, particularly when they're on public transport in indoor spaces and crowded places, to wear face coverings, to test regularly if they're going back out and meeting people, particularly those who are more vulnerable, and finally, to ensure that they've taken up that vaccination offer.